In high definition. Fox 19 News Morning Extra.
After the break, we're talking about a very serious problem.
Prostate cancer. We have an expert in the house. We're going to break down everything you need to know when the X continues. We'll be right back. And welcome back to the Morning X 941. To screen or not to screen, the prostate screening battle heats up as it perhaps is the most contentious and most important issue in men's health. Now, just recently, the federal government's Preventative Services Task Force had recommended that healthy men should no longer receive a standard blood test. Is the recommendation flawed and need to be corrected? Please welcome to the Morning Extra, Dr. Mark Delworth, a urologist with the urology group, also with Bethesda North Hospital. Good to see you.
Thank you for having me.
Absolutely. So what do you think of this new recommendation?
Well, we believe it's flawed. We believe that there's a difference between screening men for prostate cancer and the treatment. And we believe that the screening really just identifies a group of men that are increased risk for prostate cancer and really should have the option to be screened and therefore treated.
Mm-hmm. And who made up this task force?
It was a government task force appointed. It was appointed by the U.S. government, and it was composed of primary care physicians. So unfortunately, we didn't have any urologists, medical oncologists, or radiation oncologists on the task force, cancer doctors that deal with this condition every day.
Because as you've been tracking blood tests in men over the last few years, it's definitely helped, right?
No question. Since the use of PSA in 1992, we've seen a 40% decrease in the death rate of prostate cancer in the United States.
Okay, so what happens now with this new recommendation?
Well, we really believe that men should go back to their primary care physician, people that they know and trust, and have the conversation about their own health and put that decision back in the hands of the doctors and the patients. We believe that PSA screening will save lives, and if we take that away, we put a lot of men at risk. Before we had PSA screening, over 50% of the men diagnosed with prostate cancer had very advanced disease, incurable essentially. Now it's less than 10%.
So what is your advice to men? When should men be going through the screening? And is there a particular group of men that are more apt to get prostate cancer?
All men, we believe, should get screened at the age of 50, and that includes a PSA blood test and a digital exam. Now, there are two groups of men that are higher risk. Those are African Americans, 60% more prone to get prostate cancer, and men with a positive family history. And we'd recommend those patients be screened starting at age 40.
Mm-hmm. And how often is that? Is that once a year?
It should be yearly. It should be yearly after that. You can include the digital exam with your physical exam and the blood test with your cholesterol screening and other blood tests.
All right, Dr. Delworth, good advice. Thank you so much.
Thank you so much.
Appreciate it. Absolutely. After the break, one more time, we're checking in with